If you struggle with focus or attention issues and you're considering getting on an ADHD medication, then watch this video first before you do anything. Hey, I'm Dr. Sam McDonald, brain health expert, helping you rewire your brain so you can live a better life. If you love this content, make sure to like and subscribe so you get the notifications for each week's new video. So when it comes to any kind of neuropsychological or neurodevelopmental issue, it's really important to ask the question, what's actually happening in the brain of X condition? So in this particular video, we're talking about ADHD. So it's really important to ask the question, what is actually happening in the brain of somebody who has ADHD? Well, it may seem odd, but ADHD is actually a problem of a understimulated brain. Reason for this, and probably starts to make sense as you look at the classification of medications that are used for ADHD, they're stimulant medications, which seems kind of weird because if you have ADHD, you may feel like you're already overstimulated. So you may be wondering, okay, why am I taking a stimulant medication? Well, when it comes to ADHD, we're looking at activity in the brain, specifically on the right side of the brain and in this area here, that temporal frontal region. What's really important to understand is that when it comes to attention and focus, all but one of our attention networks are on the right side of the brain. The only one that's not is what's called short-term reward-driven attention, and that's on the left side of the brain. And this is going to be engaged in things like video games, cell phones, social media, email, notifications, anything like that that's going to give you that rush and that reward, that's going to fire that left side of the brain. Anything else, things like non-reward, long-term driven attention are more right side, and think of this as more like sitting in a class, having to pay attention to a teacher, sitting in a meeting or a presentation and listening to somebody and really trying to tease out the important pieces of information that you need. That's all right side of the brain. And when the right side of the brain is running slowly, you're not going to be firing these attention networks, which means you're not going to be able to pay attention appropriately. Now, there's other things that come in conjunction with this too, but really the next important question to ask is really how effective is ADHD medication if you're wanting to help yourself with a focus and attention issue? Well, one of the most prominent studies that was done looked at children in a 12, 14 month, and then a 6-year and 8-year follow-up. They profiled 436 kids, and not surprisingly, the first 12 to 14 months, the ADHD medication was actually very helpful. So kids that struggled with being able to focus in school showed dramatic improvements. However, on the 6 and 8-year follow-up in the study, what they found was no significant difference between the medicated and unmedicated groups, which means that ADHD medication, and this is seen and profiled and even discussed in many more common level examples, or people that can just share their own experiences and personal experiences, will say the same sort of thing, that yeah, the first maybe year and a half seems like the medication's really working well, but then they're having to bump up the dosages and they're starting to see that, wow, the medication's really not effective like it was. And years down the line, what we're really seeing is that there's really not much difference. I'm still having, they will describe still having problems with focus, still having problems with attention, and now appetite is suppressed, having problems then with usually digestive issues along the way. And what the really conclusion of the study and what they found was that, again, no big difference between the groups. What they saw in children on ADHD medication was actually they were about an inch or two shorter than the rest of the children that they had looked at. So height disparity was probably one of the biggest results of that. So it's really important to understand what's happening in the brain if you're struggling with a focus or attention issue. It's not a Ritalin or an Adderall prescription deficiency. It's actually a problem of what's happening in the brain. And this is where you need to start to look at things like retained primitive reflexes. How well does the basic functions of your brain work? Is your brain considered immature? You need to look at things in the parts of the cerebellum responsible for balance and coordination, and most importantly, eye movements, being able to track things appropriately. Like if you're reading, if your eyes get fatigued and tired, well, you're not going to be wanting to pay attention to a book or a teacher or reading paragraphs in a presentation because your brain's fatigued and it's already running slowly, so you're not going to pay attention even more. And then lastly, really again, is there a brain imbalance where that right side of the brain is really running at a slower rate than the left side? If that's the case, then you need to correct this brain imbalance so that both sides of the brain are sharing information equally, you're able to focus and process information efficiently, and you can actually pay attention and do something with that information. On that note, you should be healthy by choice, not by chance. And for that reason, I will see you on the next video.